welcome to the latest health news that you will not see on the mainstream media. That's what we do here all the time. But now what's happening is you see a coronavirus. So I know we're talking about this, but it's also important that you make sure you stay up to date and informed about the latest things going on. You know, is it a hoax? Is it not? Does it have a lot of people that are injured? Is there going to be more cases coming up? How is the transmissivity rate? What is the infection rate? What is the fertility rate? All of these questions we must ask. And then what treatments to use? Are they developing a vaccine in the making? Yes, they are. But what could you do naturally also, just so you know, for backup plan, and also because so many people would be going to get that vaccine, and that also increases your chance of exposure, and also a lot of other problems and economic situation may be on our soldiers. So we need to be aware, we need to be prepared. So what is another thing we can do is avoid those drugs that we know are going to be bad for us or potentially lead to other problems. So we want to treat one symptom typically, right? And then it comes down to using a drug to treat it, which can often cause other symptoms, other problems. And if we're not looking at the root cause to this disease, then yes, we're just treating symptoms. So what we're talking about here is actually a popular pain reliever that triggers 20% of liver transplant cases. So people saying, oh, you need a liver transplant. Well, actually, it could be because of the drugs that you're on. And this is a correlation among many correlations that maybe perhaps doctors don't see when they're giving out these procedures, when they're giving out these drugs. All these things that you see, there's fault lines between not just the doctor, but also the surgical person and you in particular, because you decide to go on these drugs. Ultimately, you decide what to do with your body. And so it says, could our nation's dependency on prescription and over-the-counter drugs contribute to the prevalence of liver transplant surgery? Okay, it says taking a popular pain reliever can damage the liver and increase the risk of heart disease. In August 2019, a team of researchers published a paper in the Journal of Cardiovascular Pharmacology and Therapeutics. Now notice, cardiovascular, I actually have a past video on this called The Food World Order, and you'll see that cardiovascular disease is actually the biggest thing affecting Americans. And this is true, you know, everything from heart disease to high cholesterol to high blood pressure, that's exactly what's happening. And so it says, here's some of their findings based on the large pool of data from other studies. So it says the side effects of these drugs are responsible for at least 100,000 hospitalizations and 17,000 deaths per year in the United States. And I did a video recently about hospitals and how actually some diseases could be created in hospitals, things like sepsis, for example. So keep that in mind, right? You get in the hospital for something else, something not related to sepsis at all, perhaps, okay? And maybe it has some sort of correlation. Maybe you have a weakened immune system in general, and that contributes to a lot of these problems, which it does. And then also your exposure to the coronavirus is going to be increased, which it does. And we know that, right? Because your immune system is like that barrier, that defense zone, that shield that keeps you away from all the fire, that shield that keeps you away from all the inflammation, in other words. Right, all the different pathogens that are out there. It's not just coronavirus, it's superbugs. You know, we saw that in another video I did. It was that it was in like as much as, what was it, 80% of Walmart meat. Unbelievable stuff. But that's what's happening, especially in a culture that overuses antibiotics and contributes to such problems through many different ways, as I detail heavily in these videos leading up to the coronavirus, not only when it just happened. So it says more than half of liver failure events caused by drug overdose and 20% of liver transplant surgeries are caused by acetaminophen, which is about 8,000 liver transplants occur every year in the U.S. Meanwhile, anywhere from 80 to 100 million Americans have non-alcoholic fatty liver disease and don't know it. That's a really big thing. It's a lot like leaky gut, where a lot of people don't know what this is. So if you don't know what it is, please look it up. Fatty liver, leaky gut. Okay, these are very, very big cases, and oftentimes, you know, you see the liver, you see the kidney, they work together. Very good for detoxification. I mean, you know, the kidney regulates water. Water within itself is very good for detoxification. Whether you're doing a water fast or intermittent fasting, that's one way you could do it. But also, if you look at a lot of these foods that create detoxification effects, things like fruit pectin and apples, for example, right? You also notice that these fruits are high in water, so it makes sense. But also, like, you know, looking at that, water defeats fire, which is inflammation. So this all connects here. And if you're looking at the liver, yes, it's your detox zone. It's what is going to actually deal with a lot of these bad diseases that we see. Not necessarily viruses for a whole, because viruses will affect you in many parts of the body. In fact, that's why everything just shuts down and people are just falling in the street just nuts, which is why I encourage you to watch my video during this time indeed, because it just grows in overwhelming importance. But, it says, meanwhile, all these people have this liver disease. That within itself is a whole nother issue. And that could be another thing that a doctor may say, okay, well, let's throw a drug that way. But how did these things develop in the first place? They develop through an unhealthy diet. And what is the best thing you can do to actually reduce your risk of getting the coronavirus, for example? It's by getting a healthy diet. Okay, so a lot of this comes down to that. I'm not saying that, okay, you have to be eating a vegan diet. Like, that's not the case here. Or you have to be eating any diet, okay? That's often the problem, right? As people jump on these things, they lose track, it's not life-term sustainable. Long-term, long sustainable, but I say life-term because it's literally you're dealing with your life here. And are you going to go on something that is just some fad, some trend, or are you going to do something that actually cares for you as a living being? And it says NSAIDs, which, not including aspirin, are also linked with an increased risk of cardiovascular problems, including stroke, heart failure, and electrolyte imbalances. I believe I have other videos on this as well. So crazy that we see all these correlations between drugs and diseases. Now, some people that may not be a surprise, right? I mean, okay, drugs, correlations with other things that just happen. It's like a domino effect, but it's important to know this because many people are on these drugs. Many people are dependent on them, and yes, they have alternatives, or they have things that they can add complementary. So let's say you're going to go for the vaccine that comes out for the coronavirus, or let's say you're going to go in for chemotherapy if you have cancer. Like, yeah, they're not considered natural treatments, but you can still add in natural treatments. They're meant to be complementary medicine, right? They're meant to be called holistic or traditional medicine, the medicine that's been used for thousands of years. So it's not necessarily that we should just use natural medicine or just use mainstream medicine. In fact, that's the problem, right? Is oftentimes we have an imbalance and we need to bring things more to a balance. And then we can see for ourselves, well, what does work better, this or that, at least once we try both of those. But if people don't try it, they would never know. So even the Food and Drug Administration has had to recently expand their warnings about NSAIDs and their potential role in contributing to cardiovascular disease. And by the way, we'll talk about some of these natural pain relievers you can use instead. I believe I also have a past video about that. I mean, at this point, we're going to have a video about everything soon, because this is often the stuff that affects Americans the most, which is why I put it out there. So if you're interested in that content, please subscribe. It's important that we make sure everybody's aware of what is just abundance, okay? So yeah, it's the superbugs, yeah, it's the virus, but it's also cardiovascular disease. And when you have these diseases, it increases your risk for these viruses. So the authors call for judicious individual clinical decision making about the prescription of NSAIDs and advise healthcare providers to consider all these aforementioned benefits and risks, both CVD and beyond, in deciding whether, and if so, which NSAID to prescribe. Okay, so really making a educated decision, and that's also for yourself, again, because you're the one that ultimately decides to do this. So do you see all your options? Do you realize the effect it really does? Have you done the research on the drug, for example? Have you seen all the independent studies? How long has this drug been in existence? Because we know the FDA always recalls a lot of these drugs. So then it says curb your NSAID intake with these 5 natural pain relievers instead. So here are some of the alternatives that we can talk about. It says if you're tired of relying on expensive medications that are causing unintentional effects on your health and organ function, check out these natural pain relieving options and find out how they can help you. So, it's a matter of experimentation, by adding in one food, seeing how you feel, adding in another food, see how you feel. It might not just be supplementation, okay? Foods are going to have this whole package of all these compounds, but look at turmeric, a powerful anti-inflammatory. My tip there would be adding black pepper, okay? You need to add black pepper to turmeric. It increases the potency by thousands. Very, very important. And then if you look at turmeric and black pepper, you might also want magnesium, because magnesium is something, I know it's not mentioned here, but magnesium is something that is known as the forgotten mineral, something a lot of people are deficient in, and something that could actually help people a lot, not only people who exercise a lot, and not only people that look for flexibility or better circulation, but it has over 500 different functions in the body, including that of helping ease on the pain and help you actually get sleep, which is like a double combo, which you see in a lot of these foods when you actually combine them and create this synergistic effect. So it says acupuncture and other holistic treatment options, right? So maybe you just add one at a time, but maybe you have a lot of these in combination. I mean, the amount of effects it may have on you, that, for example, could reduce stress. Okay, and it's not only just pain relieving, but stress relieving, and perhaps stress is one of the main reasons why you have the pain to begin with. So again, if we're looking at the root cause, maybe it's a certain way you're sitting, maybe it's a certain way you're doing something, and getting down to what is it exactly, we have to ask questions. We need somebody out there as well who can also ask us the questions, since we're living this life and sometimes we're very unconscious of what we're doing in our own life. So we need other people sometimes look at us and at a more objective point of view for who we are and who we present ourselves to be. Right? Because it could be a tendency, right? Like for men, for example, they'll have their shoulders up when they're dancing, or simple little things like that, but that's going to lead to shoulder tension, right? Especially if they dance a lot. I mean, I'm just, a random example rather, but acupuncture has been around for a while now, and it's actually growing in importance for that reason. So then you see exercise, just don't overdo it. Exactly. I have a video about how less exercise is more. Please check that out if you're interested in some of the best exercise you can use. So aloe vera, another thing, great for skin, great for a lot of beauty health, if you will, but also great for a lot of beauty care products. And it says it has both anti-inflammatory and analgesic properties, according to the U.S. Pain Foundation. Mindfulness practices including 4-square breathing, meditation, and progressive muscle relaxation. So aloe vera is something that you may be able to apply in different situations. As I mentioned, everything from beauty care products to your skin. You can drink aloe vera. You can use it for sunburns. There's a lot of uses for aloe vera. It's a very common ingredient in skincare products, and it seems relatively cheap, not too much when you compare it to other things. For how much you can actually do, it's abundant. You could say the same thing often about baking soda or coconut oil or apple cider vinegar. Some of the stuff could of course help too in some degree, but we're looking specifically at this. Aloe vera might be able to help. There's a lot of anti-inflammatories out there. Turmeric's just a really popular one right now, but you can look at ginger. It's in the same family. Like I said, look into magnesium. You can look into a lot of different plant-based herbs. They all have some sort of anti-inflammatory effect of some kind. It's just about finding the right one for you, frankly. Maybe you don't do so well with turmeric. Maybe you want to look into, pineapple has great digestive enzymes. Maybe it's bad digestion that's causing your pain. Look, it could be a whole host of different things, but don't up, because pain is something some people will go on their whole lives and think, well, it's just, I don't know, it's like, I don't know where it comes from, I just feel it. And they describe it in a way because they understand it more than sometimes the doctors, and I understand that. So it's about experimentation and really investigating with the options that you have. And there's certainly, with the internet, you have an abundant portal to look at these options, so please use it to your best ability. It might be able to help you. Thank you very much for watching. This is Cory, Edmund, Endrulat, Nature's the Answer. Thank you very much for watching. Take care.